My name is Janessa Kropp. This is for United States University FNP 596 for the SOAP Note Clinical Experiences Discussion Board. This week I will be doing the geriatric cardiovascular SOAP Note. The PCID is 2935529. Patient initials are MK. He's a 65-year-old white Caucasian male. He arrived at the clinic alone and is a really good, proper historian. He is there to establish care and to get a renewal on his blood pressure management medications. He had just relocated to the area due to retirement and was looking to establish care with a clinic, as well as get a refill of his blood pressure medications. He states he's been on these medications for 8 years and has found that his blood pressure is really well managed on them. He takes amlodipine, a calcium channel blocker, 5 milligrams daily. He does take a blood pressure log at home, and he brought that with him to the visit. It shows 123/79, 129/83, 125/77, 123/81, and 124/74 of the previous week. In office, it is found to be elevated. We'll get to that in a minute. But he's integrated more strength training, cardiovascular resistance training as well, and he walks daily with his wife and is very healthy. His medical diagnoses would be hypertension, well managed through medication, pharmacological measures, as well as lifestyle changes. He currently has no other diagnoses. Surgical history, he reports no surgical history ever. Allergies, he has no food, medication, or environmental or seasonal allergies. The medications that the patient is taking is amlodipine, 5 milligrams daily. There are no other medications. He does take supplements of CoQ10, fish oil, D3 1000, and B12 daily. He is up to date on all of his vaccinations. He did not receive a flu vaccination this year, and his last COVID vaccination was in 2021. He reports a familial history. His brother has hypertension, a lot worse managed than his. He's on a lot higher doses of medications and hasn't integrated lifestyle measurements and has seen a increase in the disease. No other significant familial history there. The patient is retired. He worked over the years as a CFO for SkyWest Airlines, as well as a CEO for Flex Fleet Truck Rentals. He has retired and moved to the area, which is typical for this area, seeking new medical care. He has been married for 42 years. He reports no tobacco product or alcohol consumption use. He finds purpose in his religion, which is the Church of Jesus Christ of Latter-day Saints. He works in the temple once weekly with his wife and every Wednesday morning. He has 5 children and reports close relationships with all of them. He has 2 daughters living in St. George and was up in northern Utah, Salt Lake area, where the rest of his other 3 children were. The patient denies any weight gain or loss. He said his weight has been very constant over the last 10 years. He's feeling more energy since his retirement recently. He is now sleeping 8 hours a night. He reported while he was working about 5 hours a night. He's reported a drastic stress load reduction in retirement and is overall very happy in his demeanor. His cardiovascular, he denies shortness of breath when he is exercising or at rest. He denies chest pain, palpitations, or edema. The patient also denies cough, wheezing, or respiratory exertion. The patient's vital signs were all within normal limits, with the blood pressure slightly elevated at 135/87. He said he does suffer from white coat and always finds it's elevated in office, and that's why he brought his blood pressure log. That was the only interesting finding on the exam. Overall, he looks well nourished. He's dressed appropriately for the desert climate. He's relaxed. He's in no distress. The EKG performed shows normal and appropriate sinus rhythm and rate. Auscultation shows no murmurs, rubs, or audible arrhythmias. There's also an absence of edema in the periphery. Respiratory, all auscultation points are clear with negative wheezing. No audible cracks or no cough present with deep inspiration, and respiratory excursion was symmetrical. The top 3 differentials for this patient is essential or primary hypertension with ICD-10 of I-10, other specified counseling Z71.89, and 3, overweight E66.3. His BMI was 26.8. He said he's been really steady in that weight for about 10 years, and he recently has put on a lot more muscle with strength training, but has found his weight stays the same. Medications, treatment plan is we're going to refill the amlodipine 5 milligram for a 90-day supply. And the patient is going to continue his strength training, but we're going to try and increase a little bit more of the cardiovascular training. He said he likes to bike, and the weather has been really nice here in this desert climate. So he's going to start biking more to increase his cardiovascular health, get that circulation going, especially since he's less active in retirement, making sure we prioritize a step count. He's going to be getting a step counter watch, and we're aiming for 7,500 to 10,000 steps daily, and help maybe bring down the weight just a hair to a normal range, because this can be a normal finding in our retirement patients in our community. After they do retire, they see their weight fluctuate, so we want to get on top of it before. Patient's still going to monitor his blood pressure at home to detect any future visits and see if he needs to come see us prior to his 90-day follow-up. Other than that, he will report back to the clinic in 90 days for a new renewed prescription, and we'll look at the blood pressure log and see if any changes needed to be made. And this is a really common chronic condition that we see in our community. We see a lot of geriatric retirement patients with hypertension. Typically they do have comorbidities, and this patient's extremely healthy, but final diagnosis is primary hypertension, and this is going to be managed through both pharmacological and lifestyle changes. Thanks.